we'd like to invite you to come to our 29th Mammography in Santa Fe course that's coming up August 4th to 8th, and we'd like to tell you a little bit about it. My name is Mike Linver. I'm the Director Emeritus of the Breast Imaging Center of X-Ray Associates of New Mexico, and I'm currently on the faculty as Clinical Professor of Radiology at University of New Mexico and George Washington University. I've been a breast imager for the past 38 years, and I've actually been very active as a teacher. I've given over 1,600 lectures in 25 countries. I founded this breast imaging course in 1996, so I've been doing it as the director or co-director, now with Chris Comstock, for the past 29 years, all 29 years of the course. I've authored about 60 publications in mammography. I was chosen one of the 10 most effective radiology educators in the United States by Aunt Minnie a while ago, and I'm a fellow of both the ACR and the SBI, and I actually received the gold medal of the Society of Breast Imaging in 2021. Chris, you want to tell us a little bit about yourself?
Sure. I'm a breast imager. I started with breast imaging with my fellowship at University of Chicago back in the mid-90s. And I actually met Dr. Linver, I think, through Bob Schmidt and the courses they were running at the time down in, I think it was Boca Raton was the first conference, and also at the SBI meetings when I finished my fellowship and stayed on as faculty at University of Chicago. And that's, I've known Mike since then. So I've continued on doing just breast imaging. I was the section chief of the breast section at UC San Diego. Moved to New York. I was at Sloan Kettering for 16 years, I think, and now I'm at Weill Cornell Medicine in the breast section there. I've been pretty involved in research and multi-center trials. I did a fellowship, an Akron fellowship in medical imaging trials, multi-center trials. I've run a couple of studies, including abbreviated breast MRI, preoperative MRI trial, and I'm currently running an active contrast mammography trial called CMIST. I'm a fellow of the American College of Radiology and the SBI. I just recently, last year, was appointed as the chair of the Research Commission at the ACR. But in terms of education, Mike and I can't remember how long I've probably been involved with the Santa Fe course, about 15, 16 years or maybe longer.
Yes.
And we also were quite involved together in the mammography boot camp at the ACR. So Mike and I go way back in terms of conferences and mammography education. And so, we'd like to have this discussion to inform you if you're not already aware of this conference, but to go over its benefits and some of the highlights of the conference. So maybe we'll go on to talking about maybe Mike, you can take us back and tell us how the whole Santa Fe course was inspired and came about 29 years ago.
Yeah, it was 1996, and I had been to several of Dr. Laszlo Tabar's courses, and I saw how effective his workshops that he ran with using cases, a case-based course showing many cancers and normals, and how people could learn much more directly through active learning rather than passive learning. And
right.
And this concept was not being taught by anybody else. And I thought, this is something we ought to do. And I was encouraged also by Gillian Newstead and Bob Schmidt, the aforementioned Bob Schmidt, from Chris's mentor. And the three of us put together about 100 cases on a film screen, of course, 1996. And we presented these at our first conference in 1996. And it went over incredibly well. And we started building it from there. And we saw how successful it was year after year. And we said, this is the way to teach. Active learning is the way to go. And nobody else was doing this.
And I remember at the time, I think I helped at one of the conferences, but I remembered at the time you had to ship those big alternators, and it was using film. So we had to hang all the film on the alternators. But I agree 100% because I've always felt these types of, particularly for mammography, compared to a conference where you go and you listen to some lectures over the weekend versus actually going through cases. When you go back to work the following week, you've really, through this case-based approach, you've really learned a lot and trained your eye, and it's really, it's improved your interpretation skills versus kind of passive listening to lectures, which I don't think really translates to that benefit that you take home to your practice. So tell us about how from those early days, how things have evolved with the Santa Fe conference.
Well, we continued to teach in this manner. We had 4 faculty at first. Now we're up to 13. And but the big advance occurred in 2007 when we went from film screen to digital. And we had the largest digital case set of workstations and ever done in the world. And at that time, we had 25 different workstations, so 25 people could all see cases on their own workstation. And this worked so well that it continued to evolve. Chris was involved at that time. It was back in 2007, and he's helped us ever since in putting these cases together. And we went from 100 cases. Now we've got not only digital 2D, but now we've added tomosynthesis. We're up to 300 cases at the workstation. And this year we're even adding AI to all of those tomosynthesis cases. So it's evolved dramatically with the advent of digital. But also, Chris added a new wrinkle about 10 years ago. Chris, why don't you tell us what you added that made it an even more powerful active learning experience for the attendees?
Yeah, and I think one of the biggest things was, the format that other people and how we started with the review of sessions where everybody kind of had to sit through a session and get the feedback on the cases. We added that instant feedback right after each case, really allowed people to work at their own speed and go through the cases, on their own in a much more efficient way than kind of all being part of those large review sessions.
Also, Chris, by doing that, people could learn as they go. Instead of waiting, they would look at all 100 or 300 cases, they'd make notes, and then we'd go through them all at the end of the session, but they wouldn't even remember necessarily what they had put down for the abnormalities. This way, they see the abnormality, they click on your little iPad thing that you have next to the tablets next to the computer, and they get an immediate answer whether they're right or wrong.
Yeah.
And if right,
and that has just much more impact than finding an answer about a case they looked at 2 days ago. So I think that immediate impact really helps in terms of training the findings and the impact and the feedback.
The eye training is so important by showing so many cancers, but the beauty of this is that if they miss something and they see what they missed, they go to the next case and they see the same kind of lesion, they can identify it because they've learned what that was correct, and they no longer make the same mistake. So they learn as they go, they become better breast imagers as they go through the cases. It's a remarkable way to learn. Just fantastic.
Talk a little bit too about the it's not just the workstations, but the hands-on and the biopsy workshops.
Oh yeah, and not only, I should also mention that we've added breast MRI, and in the future we're going to be adding that again with the same mechanism of case-based courses. But we also always have had workshops where people can practice their skills at doing ultrasound-guided core biopsies on turkey breast models with multiple ultrasound machines, so everybody gets a chance to use all the latest equipment to practice doing the biopsies with ultrasound. And also we've almost always had stereotactic biopsy capability to teach that technique well. So all of these are part of the course every single time, and that's really made it a truly interactive experience for everybody who attends.
Yeah. Do you want to share some stories of kind of feedback from the attendees and highlights over the past 29 years?
Yeah, well, one of the first was something that happened the very first time we did the course back in 1996. I got a phone call about 2 weeks after the course from a fellow who was running a very large breast imaging center in San Antonio, very large, a big hospital. And he was highly skilled, but he called me and he said, I have to tell you what happened. I came back, and yesterday I found a 6 millimeter, highly aggressive, invasive cancer that I never would have seen, never would have identified without having been to your course. And it just blew me away. I said, wow, this is a powerful tool. What a way we can make a huge difference for everybody who attends. This is our sphere of influence becomes huge by through this course and this method of learning
Right.
active. We've had over 3,000
Yeah.
people in the course now, and everyone.
And that really, yeah, and it really translates into improved, patient outcomes.
In fact,
So yeah.
one time I actually did a pre-workshop study where I had all of the attendees look at a set of 50 cases and before they ever got any of the teaching tools. And then I had them at the end of the course look at the same 50 cases in a different order, so it didn't register the same way. And I looked at the scores. They found 30% more cancers, having had the advantage of going through the course. It was
Right.
really blew
Yeah,
me
I think
away.
it truly does, change and improve, radiologist interpretive skills, having this whole workstation based and case based with feedback. I've seen that also, so I 100% agree.
Yeah.
Um, let's talk a little bit about what makes, there's lots of other CME options, and what makes the Santa Fe conference unique among some of the other CME venues that we all know about and have been around for a while.
Well, it is purely in a class by itself. It is the most comprehensive interactive breast imaging meeting in the world. Nobody offers what we do in terms of this active learning experience of going at the workstation just like you would do at home and seeing case after case in full resolution, and the ability to improve your interpretive skills goes up astronomically. No other course.
Yeah, and I don't think we mentioned, but this is actual on various vendors. There's options for multiple vendors, and you're reading on actual PACS workstations. So it really is an experience similar to your clinical practice, and it allows, if you're joining a new group or moving to a new center or a new PACS system, it's really an opportunity to learn how to use the system and review cases and try out various vendors.
Absolutely. And now with AI, you can try different AI vendors too. But the other beauty of this is that if you are just getting back into practicing breast imaging and you need to get your 240 cases interpreted to be reestablished for accreditation to read mammograms in the United States, this will give you that uh, dramatically, automatically. You'll be MQSA qualified, and
Right.
you need more cases. We have them for you to read. And if you're interested in being somebody who does contrast enhanced mammography, we've added that this year too, which is highly
Right.
unique. All these
Yeah,
are
I think that's always been a struggle for radiologists, particularly. It's very common that you have a lot of movement in the job market, and radiologists start new positions and they're asked to do mammography, which maybe they haven't done in a while. And how do they get that reaccreditation? There's not a lot of options. I think. I mean, you can speak for this. I think the ACR Ed Center, which we obviously created the boot camp, is I think it's on its last just its last few courses. But outside of that, this is really one of the only places to go and get the numbers for requalification, because it's really, what other option do radiologists have? It's not easy to go to some colleague at another hospital and say, can I come look at cases or overread with you? So this is really one of the biggest benefits of this is for radiologists looking to recertify and brush up again and start reading mammography again in whatever their practice or new practice or their changing responsibilities are.
Exactly. Plus, the fact that if you just go and sit behind somebody and to get your 240 cases read, you don't learn anything.
Right.
Here, not only do you get your cases, numbers you need, but we have faculty there to go over the cases with you. And in addition, you get an answer on every case. You know whether you're right or wrong. So you really learn what breast cancer looks like and your ability to identify it and improve those skills as you go. There's nothing else like that anywhere. That's what makes this course so unique, so valuable as a teaching tool and as a way to improve your skills as a breast imager.
Right. So, and there's not only the accreditation numbers, but also the CME hours, which is, it's a great combination, this type of format, and hours of, for digital mammography and tomosynthesis accreditation.
Yeah, not only that, we have a world-class faculty to give over 25 hours of CME lectures over the week. People like Laszlo Tabar, Tom Stavros, yourself, Chris, people like Jessica Leung, and whole variety of the best.
Tula Destunas and Emily Conant, and the list goes on and on. Katja Pinker's come, and also we have now added Sarah Winkler for to add some focus on the AI aspect of mammography and interpretation.
These are the best teachers of breast imaging in the world. That's why they're on the faculty.
Let's talk a little bit about in terms of attendees. I know you know better than I do because you've done it for quite a while, but I think there's quite a high repeat rate of which is an amazing testimonial itself, is the number of people who come back each year to do the course.
Yeah, I'm always astounded. And on the first day of the course, I always ask, how many have been to this course before? And about half the audience raise their hand. Literally half the audience. So we have so many repeat people because they love the course, they love the format, they love the opportunity to continue to improve their skills, and they do every single time. I get testimonial after testimonial from these people. That's why they come back. They love it. They love the opportunity to improve their skills.
So can you talk a little bit about the IICME and how the structure is in terms of how patients register and their choices in terms of what type of hands-on and didactic-based program that they have options for?
Sure. We understand that some people just want to do the didactic side, so they can register to do just the didactic lectures. But in addition, if they want to do the 240 or 300 case mammography tomosynthesis AI at the workstation review, the workshop, they can sign up for that as a separate option. And in addition, we've now added contrast enhanced mammography as a separate edition as well. Part of the didactic course does include the ultrasound guided core biopsy and stereotactic core biopsy workshops. That's part of the standard course. Right. But you can do as much or as little as you wish. It's like a smorgasbord,
And the workshops are generally held in the starting at about 3:30 in the afternoon. So and attendees can work depending on the number of if they've signed up for more than one workshop. That the workstations are available into the evening. So we have people who work pretty diligently through the course of the conference. And there's also, did you want to mention the whole breast screening ultrasound? That's another option.
Yes, we have the so-called ABUS unit there, and it's a full unit. We actually have a separate 6-hour course they can sign up for to learn how to do ABUS. Sue Rue, who is one of the two most outstanding teachers of ABUS in the country. She's done more cases than it's 10,000 cases now. She is our lead teacher on that, and they can really learn how to do ABUS while they're there as well. There's a whole teaching set that they each have their own workstation, just like on the Mammo and the Contrast Enhanced. They have their own workstation to learn during that special course that is also included for a small additional fee.
Okay, well, I think that really takes us through the history and the current the structure and offering of the conference, and we hope to see more and more people come. I think people come and they realize, well, this is a very unique conference, and I don't think there's anything that offers the combination of lectures and faculty and CME. What's the CME hours, I think, for the Monday through Friday, the conference?
Well,
Do you have the number for that?
I think for just the didactic part, it's about 25 hours of CME. If they add on the workshops, they can then have well over 40 hours of CME.
Yeah, for the so the workshops have faculty monitors there for questions and feedback, and so that goes till about 6 o'clock each evening. And so during that time, they'd also have CME credit during that one-on-one opportunity to review cases and findings. So is there anything you'd like to add or reflect on as we finish here?
Well, I'm just so pleased we've been able to continue to do this for 29 years. It's a remarkable tribute to the course itself and its lasting value. We've had over 3,000 people go through the course, overwhelmed by the response we get. It's so unique, and I do want to keep it going because I'm committed to it. I'm obviously been around for a while, but I continue to do the course because I'm passionate about teaching, about this method of teaching. And I'm so pleased that Krista, you've joined now as co-director because you offer a whole new set of skills in terms of teaching methods. And I just hope people will take advantage of this truly unique and extremely effective teaching set that we put together in Santa Fe.
Yeah. And I think really what also I've enjoyed is the fact that we've tried to keep up with current trends and keep the conference up to date, and that over time was we brought on we did MRI in the past, and now we've started to add, and this is our major focus now, is on mammography AI, which I don't think there's a radiologist reading mammography who's not going to be impacted. So it's an opportunity to really understand that and get some experience with interpretation of mammograms and tomo with AI, and also now contrast mammography is also becoming more mainstream. So I think that's another benefit of the conference, is really it keeps radiologists up to date, and we continually look at the feedback and look at what near-term changes and new technologies are coming to breast imaging, and we've tried to keep it very informative and up to date. So I think that's another plus to the conference. So anything else to add, Mike?
Well, I think we've covered most of the basics. I just hope people will take advantage of the course. It's out there.
Yeah,
it's also a beautiful setting. Santa Fe is considered the second popular venue in the United States. It's in that time of the year, it's 85 degrees during the day. It goes down to about 60 at night. The Santa Fe Opera is going on, the Chamber Music Festival, 400 art galleries, second biggest art market in the world, 40 world-class restaurants. It's a wonderful, it's a destination in itself. And
I mean, there's fantastic things to do there, and absolutely the restaurants are fantastic. So there's plenty to do, and lots of options depending on how involved you get into the workshops and cases, or how much you want to kind of make it a mixture of CME and Seeing Santa Fe. So I think it's a fantastic course, and I thank you for all the years of putting this and keeping this conference going. And there's really nothing like it. So we hope to continue it for many more years.
Sure do. And with your help, Chris, I know we will.
All right. Well, thank you. Thanks, Mike. And we hope to see you in Santa Fe this year. And feel free to reach out if you have any questions to the IICME website. And we hope to have you come, and look forward to having you see you at the conference and the meetings. Is there anything to mention in terms of early bird registration, Mike, or deadlines
Oh, yeah.
for that?
Actually, we are offering a $100 discount. It's supposed to end on July 4th, but if you are watching this recording and you still want to attend, we will honor that $100 discount for another 2 weeks. So please, if you have a chance, sign up as quickly as you can so you can avail yourself of the discount. And it's iicme.com. Just go to that website and you can register right online, and we will honor that $100 discount if you mention that you watch the recording.